Today, with the technique of cortico-basal implantology, it is possible that we can fix their teeth, the fixed teeth, in a short period of time.
But mono implant, in my opinion, is the best choice because it's very fast.
India. So welcome. Please put your hands together for Dr. Jay.
There is no competition for mono implant. The bendability, the adaptability, it suits whatever kind of technique you are using. Mono implant is the best.
An inauguration ceremony has been organized by VK Dental India and AIM Academy for the second global conference ongoing on Friday 9th August, 10th August and 11th August at JW Marriott Aerocity, in which delegates from more than 10 countries were invited and were accompanied. All the companies took part in this event and elaborated how can the dental treatment be done quickly with the newly introduced technology. A number of workshops were organized in which experienced dental doctors shared their experience with everyone about the newly introduced technology of cortical basal implantology, which is far better than the conventional method of implantology, which had a number of risk factors. And the delegates also shared and told how patients can be treated quickly without any incision, cuts and a surgery. And a patient can literally get no teeth to permanent fixed teeth in just 72 hours. Meanwhile, during this event, our reporter Arpita Singh chatted with the dental expertise present at the event and find out how they get this treatment done with the technology. Let us know. Hello everyone, we are at the second global conference of the basal implantology. And today we will know everything about mono implants and implantology, which is very different from the earlier one, that was a conventional implantology, which has many risk factors and was very complex. Now you people will get to know about everything about the implantology, basal implantology. Basically, you will get from no teeth to your fixed teeth in just 72 hours. And how it is going to be, we will discuss about this with expertise doctors from Romania, Brazil and in many other countries, and foreign delegates will tell you and explain you what is mono implants and how it will be beneficial, and it is very less time consuming. You can just fix your no teeth to your permanent teeth in just 72 hours. And how it will be going on, let's talk to the doctors.
Good morning, everyone. This is Dr. Virendra Kumar, the chairman for the second global conference on cortico-basal implantology, which is going on in JW Marriott Aerocity, New Delhi. So today, cortico-basal implantology is changing the way we do the techniques for incision of implants for the patients who require a fixed teeth. Earlier days, it was very common for a patients to wait 3 to 4 months or maybe sometime 1 year, which was very painful, and also the long waiting periods were the major drawbacks for the patients who wanted to get their fixed teeth. Today, with the technique of cortico-basal implantology, it is possible that we can fix their teeth, the fixed teeth, in a short period of time. So coming to the technique, the safety of a cortico-basal implantology, the cortico-basal implants are not used today, but this has been in practice for many years now. And myself itself, I have placed more than 20,000 implants, and we have a very successful stories. And you can see in this conference, which will be a 3 days program, where both the national and international delegates are going to present on various topics of cortico-basal implantology. And one of the most important aspects of cortico-basal implantology is we must have a very good mentor to teach you, and there is a long learning curve. This is the most important requirement for the clinicians who are interested to learn these cortico-basal implants. And for the patient, it is one of the safest methods. This can be used for the patients who are smokers, who are diabetics, and who need an immediate solution for their missing teeth. So I'm sure in a short period of time, we see that more and more clinicians and more patients will be asking for the mono implants, which are cortico-basal implant system. The mono implant system is manufactured and imported from Switzerland. And one of the company, VK Dental India Private Limited, is the one which imports these implants for the entire nation. And these implants are very users friendly, the clinicians friendly, and patient friendly. I'm sure this would be one of the best choice for the patient to require immediate teeth replacement.
And this is an international conference where we have many international speakers, delegates, and national speakers who will speak about this latest trend in implantology, where there is a long waiting period in conventional implants, where it takes at least 3 to 4 months for you to get a teeth. Here, you get implants on first day, and second day you can get a good set of teeth, and third day you can eat. And this procedure is very non-invasive. No sutures, cuts, grafts are required. No invasive procedures are done, and it is a very easy procedure to do. And the patient get a healthy, smiling teeth on the third day, which is a revolution in implantology. So this procedure is new because it does not involve any sutures, cuts, grafts, sinus bypass. Any patient who is suffering from any cardiac disease or a kidney disease can get it done because this is a non-invasive procedure. Even diabetic patients can get it done very safely. So we are using the best mono implant, basal implantology technique from a couple of years now. The results are fantastic.
Okay. Can you brief about mono implants for easy language for our viewers?
If I have 2-3 words to say for mono implants, a synonym would be excellent, the best, and there is no competition for mono implants. The bendability, the adaptability, it suits whatever kind of technique you are using. Mono implant is the best.
Okay.
So we have a lot of competitors, but nothing even comes close to mono implant.
Doing mono implant, and it's very nice to work with it. It's simple, it's easy to use, and it's very predictable. The outcome is very nice. That's why I'm using it for some time, and I'm enjoying using it, me and my patients.
We have increased our cases and case acceptance from our patients because we are doing minimal invasive cases. Patients get teeth in 3 days, and they are very happy with it. We have referred a lot of cases from other clinics, but other patients cannot do, and they recommend us. And our practice is increasing since we are doing this type of implants.
Is it possible in 21st century, we are in India, is it possible to restore your full restoration of your tooth in just 72 hours?
Of course, these implants are made for the immediate loading, so you can get your fixed teeth within 3 to 4 days, not more than that. So any type of the bone, we can place this type of implant, and you will get your fixed teeth within 3 to 4 days, not more than that.
It was very nice experience over here till now. The speakers, the ambience is awesome, and the mono implants are really good. I'm using it for the last several years, and the success rate is too fine, too good. Thank you.
Now, as we have talked to many doctors and discussed with them what is mono implants, they have explained you well about mono implantology and how it will be without incision free, no cuts, nothing, just your fixed teeth in just 72 hours. And let me explain you about the mono implants, what it is really. It is cortisol based. As you can see on the screen, it is cortisol based. It is possible to treat all patients with cortico basal implants, which is you can forget your bone grafts, you can forget sinus lifts, you can forget in 3 to 6 months. And now it is just done in 72 hours, and now you can treat all patients in just 3 days. Means you all can be treated just in 3 days, and you will get your fixed teeth. In the second global conference by VK Dental India and IM Academy, Yoga Guru Baba Ramdev was also present, who explained many benefits of maintaining oral hygiene and its impact on a good gut health too.
Your digestive system is healthy. So teeth and your gum.
गुरु बाबा रामदेव जी हमारे साथ मौजूद है बातचीत करने के लिए, उन्हीं से बातचीत करते हैं। बाबा जी, आप प्रोग्राम में आए थे, इसमें तमाम डॉक्टर्स थे, आपने भी कहा कि आते ठीक और तब
दांतों के डॉक्टर ना बड़े प्यारे होते हैं। बच्चों के डॉक्टर और दांतों के डॉक्टर बड़े कंपैशनेट होते हैं, और ये स्वास्थ्य और सुंदरता बढ़ाने का काम कर रहे हैं। वैसे भी बड़े प्यारे प्यारे डॉक्टर थे, सबसे मिलकर बहुत अच्छा लगा।
And this is how we get to know about the latest technology of the cortical basal implantology, which is far better than the conventional method of implants used earlier. And this was the ongoing second global conference on the cortical basal implantology at JW Marriott, Aerocity on 9th, 10th and 11th of August 2020. What are your views on the basal implantology technique? Let us know in the comment section. And for more such videos, stay tuned with punjabkesari.com.